Today we're going to be doing your head to toe assessment. Ready?
Yes.
So we're going to start with your skin. The skin looks consistent in color. There's equal hair distribution. The skin is smooth and dry. Turgor is good. On the hands and feet, again, equal distribution of hair on the legs. Legs and feet are also warm to the touch and dry. There's no signs of any varicosities or edema on the lower extremities. The nail beds are firm to the touch. The nails are attached to the nail beds, and cap refill is brisk. In the fingers, the nails are firm to the touch. All the nails are attached to the nail beds, and the cap refill is brisk. So next we'll move on to your scalp and head. The head and scalp, the skin is consistent. Any tenderness of palpation?
No.
This would be the paranasal sinuses there. We'll check the TMJ. You can clench your teeth together. So this would be the masseter muscle, the temporal muscle. Can you move your jaw side to side? Jet it forward. There's no clicks, any tenderness?
No.
So no clicks or pops are noted. The hair appears clean, evenly distributed. There's no balding noted. Normal hair distribution pattern for a male. There's no signs of infestation. Okay. Moving on to the eyebrows, appear symmetrical. The hair is coarse, evenly distributed. The eyelids are symmetrical. The palpebral fissures are symmetrical. You can close your eyes and fully cover the eye. The eyelashes are convex. They point upward and outward. You can open them. The sclera is white. The iris are brown. The pupils appear equally round. The conjunctiva is pink and moist. We'll check some things with the eyes. First, the corneal light reflex, which the light is reflected at the same point in each eye. We'll also do the peripheral vision test if you can cover your right eye. And just tell me when you see the bunny, okay?
Alright. No. 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 No.
To test distant vision, we would use the Snellen chart, which would be about 12 feet away. The Rosenbaum would be for near vision, 12 to 14 inches from your face. Next, we'll just check your pupils if you can look straight ahead. And look at my pen light. And keep your eye fixed on this point until I ask you to look at the pen light again. Okay, ready?
Mm-hmm.
Now. So the pupils are equally round, reactive to light and accommodation. The lens looks clear. We'll take a look at the internal structures of the eye. Look straight ahead. So the red light reflex is present. The optic disc is noted to be at 1.5 millimeters in diameter. It's oval in shape, a creamy yellow color. The arterioles and venules are noted at a 2:3 or 3:5 ratio. The arterioles are brighter red in color. The retinal background is clear of any exudate or hemorrhage. And I did not see any crossing of the arterioles or venules. So next we'll take a look at your ear. I'll use your right ear. The exterior of the auricle is, there's no lesions noted, any tenderness on palpation.
No.
There's no drainage noted. We'll take a look at the inside. So the tympanic membrane is translucent gray in color. It's flat, no bulgings noted, no drainage is noted. The cone of light reflex is present at 5 o'clock on the right side, which would be 7 o'clock on the left. I'm gonna whisper something in your ear if you can repeat it back to me, okay?
Alright. Merry Christmas.
Next, we're going to do the Weber test. I'm going to place the tuning fork on the middle of your head. If you can tell me if you hear the sound in your right, left, or both ears, okay?
Okay. Both.
Next would be the Ryan's test. If you can tell me when the sound stops, right?
Okay. Now. Now.
So the air conduction should be 2-to-1 to the bone conduction of sound. Next we'll look at your nose. The nose appears symmetrical. There's no drainage noted. The posterior turbinates noted. The septum is midline and intact. Again, there's no drainage noted, no foreign bodies noted. Can you occlude one nostril and breathe in and the other? Both sides are patent. I'm going to give you 2 things to smell with your eyes closed. If you could tell me what they are. You ready?
Alright.
First one.
Mustard.
And the second.
Cinnamon.
Good job. You can open your eyes. Next, we're going to take a look at your mouth. Your lips are moist and pink. There's no cracks or swelling noted. You open your mouth. The buccal mucosa is pink and moist. The tongue is pink and moist. No lesions are noted. The eye.
Ah.
The uvula is midline. Say eye one more time.
Ah.
And does rise. The hard and soft palate is continuous. Can I say under your tongue? The frenulum is intact. Wharton ducts are noted. And the Stinson ducts are also noted. The other frenulums are also intact. Can you stick your tongue out? Move it side to side. So that would be cranial nerve 12. Cranial nerves 9 and 10 are responsible for swallowing, speaking, and gagging. which we aren't going to test all those today. Next, we'll test cranial nerve number 7. Can you smile, show your teeth, frown, puff your cheeks, purse your lips? Can you raise your eyebrows and close your eyes tightly? Don't let me open them. Good job. Next, we'll test the trigeminal cranial nerve number 5. So I'm gonna ask you to tell me whether it's sharp or dull.
Okay.
If you can close your eyes.
Sharp. Dull. Short. Dull. Short. Dull.
Good job. Okay. Alright, so next we're going to look at your thorax. I'm going to inspect first. The clavicles are symmetrical. Sternum is midline. The costal angle is less than 90 degrees. The spine is also midline and scapula are symmetrical. We'll palpate the thorax for any masses, bulges, or lesions. Any tenderness there?
No.
Can you turn around for me? We're going to test for thoracic expansion. The level of T10. Can you set up? I'm going to make sure there's some skin pressed in between the thumbs. Take a deep breath. So the thumbs do move out symmetrically when he takes a deep breath. Next, we're going to check for tactile firmitus. You can say 99.
99. 99. 99. 99. 99. 99. 99. 99.
In this test for any vibration, there is vibration noted, which lessens from top to bottom. Next, we'll percuss the lungs, and it should be a resonant sound. You can just lean forward and breathe normally. Okay. Next, we'll percuss for diaphragm excursion. So I'll percuss down until the resonant sound turns to dullness. About there. We'll mark that spot. And if you can take a deep breath and hold it. And then exhale and hold it. And then measure. Which measure is about 4 centimeters. Normal would be 3 to 5 centimeters. So next, I'm just going to listen to your lungs if you can breathe normally. No adventitious lung sounds were heard. Can you turn around for me? So next we'll palpate the chest for any, or look at the chest first for any heaves, lifts, or thrusts. None are noted. So we'll palpate areas. So we'll start second intercostal on the right, second intercostal on the left, third intercostal on the left, fourth to fifth at the sternal border, and then fifth midclavicular line. Fifth midclavicular line would be the point of PMI, point of maximal impulse. There are no murmurs palpated at the other locations. We'll also listen at these locations. The second intercostal on the right would be the aortic. Second intercostal on the left would be pulmonic. Third intercostal on the left would be tricuspid. Fourth to fifth on the left would be the mitral. And then fifth midclavicular line would be the apical. Next we'll check the carotid arteries here, which there's his pulse is palpated there. We'll inspect for the thyroid. Can you look that? It's not seen on inspections. We'll attempt to palpate. Can you turn around for me? You swallow. And then lean a little to the right. So the thyroid is palpated. There's no nodules or masses felt. It's smooth to the touch. Right, can you turn back around? So next we'll listen to the thyroid and carotid. The thyroid or the carotid with the diaphragm. No bruit noted. No bruit with the bell. And the thyroid. No bruit is noted. Next, we're going to take a look at your abdomen. If you can lay down for me. Can you scoot down, I think?
About there.
Yeah. So first we'll inspect. There's no striae noted, no masses or bulges, no hernias. The umbilicus is inverted and clean. Next we'll listen. Vowel sounds were noted in all 4 quadrants. We can also listen over the arteries, which would be the aorta, and then the renals, the iliac, and the femorals would be lower. No bruise heard over those. Next, we're going to percuss the abdomen. The sound should be tympany, and the sound should turn from tympany to dullness over the organs. So we'll start at right lower again and just move around to the 4 quadrants. The sound is tympanic except dullness over the liver and the spleen. Next Next, we're going to palpate and measure your liver, okay?
Yeah.
I need to mark that. And then we'll start about the fourth intercostal midclavicular, go down until the resonance turns into dormis. We'll measure the distance. About 6 centimeters, which is normal. Next, we will percuss the spleen. Again, same procedure. And the spleen is kind of tucked under the rib cage, but it should be dormis from the 6th to 10th intercostal space. So next, we're going to palpate the abdomen or palpate the liver. So I'm going to place my non-dominant left hand under your back here. If you can just relax against my hand. When you take a deep breath, I'm going to take my right hand and press down. Try to feel your liver up underneath your ribs, okay?
Okay.
And take a deep breath. So the liver is not palpated at this time. Same on the left side for your spleen. Just relax against my hand. Take a deep breath. The spleen is not palpated at this time. Next, we'll palpate your kidneys, which are a little lower at your flank area. Here, just relax. You take a deep breath. Exhale. Inhale. And deep breath. Exhale. Inhale. Okay. So the kidneys are a deeper palpation, but I was unable to capture the kidney at this time. You can sit up. So we'll move on to the musculoskeletal system. We'll check your neck first. Range of motion would begin with flexion and extension backward, lateral right and left, and then rotation. To check the sternocleidomastoid muscles, you can push against my hand. To side, to side. Show your shoulders. Good job. To check the shoulder range of motion would be forward extension, hyperextension, external rotation, internal rotation, external rotation. Good job. To check the shoulder strength, if you'll see your arm. If you'll flex your arm, would be bicep, push would be tricep, hold your arm out, then push up, deltoid. Next would be your elbow, can you extend and flex? The strength would be the same as your shoulder for bicep and tricep. Okay, the wrists, flexion, extension. Right, and to test the strength, can you pull up, push down? And the fingers, can you push your fingers apart together, make a fist? Can you grip my hands? Can you take your thumb and touch the tips of your fingers and the base of your pinky? Good job. Next would be your hips, if you can lay down. Can you raise your leg? Put your knee to your chest. Put your foot down. Pull your hip out to the side would be external rotation. Push it in, internal rotation. Straighten your leg back out. And to check the muscles, can you push up against more resistance? Push out, push in, push down against the hand. Okay, and you can sit up. The knee range of motion, can you flex or extend and flex your knee? Okay. Can you push against? Will be your quadricep pull, be your hamstrings. Your ankle, can you rotate and pull up? Push down. Push like you're pushing the gas. Pull up. Push down. And the toes, can you pull them up? Alright, and again for resistance. Push down. Have you stand? Can you swing your leg back? Okay. I'm going to ask you to just take 3 or 4 steps to show your gait. And then walk back heel to toe, please. Okay. While you're there, we're going to do the Romberg test. This checks your equilibrium coordination. If you can stand with your feet together, arms by your side, close your eyes. So we'll just check for any swaying, make sure he doesn't fall. Okay. Or you can have a seat. Oh, sorry. While you're standing, let's do your ankle eversion. Make sure you can see that. Eversion in and then inversion out. Oh, we need to do your reflexes. Next, we'll check your reflexes. We also need to do your pulses. So the pulses would be temporal, carotid, brachial, and radial. Popliteal, posterior tibialis, and dorsalis pedis. All pulses are equal right and left and 2 plus. The reflexes would be your brachial. You can just relax your arm and come here. The brachioradialis be here. And then, can you just, yeah, there you go. Okay. And then the patella. And your ankle. You're relaxed.
I'm gonna try the all on that one's kind of stiff today.
Right. This may be out of order, but we'll do the stereonosis. If you can close your eyes. Can I see your hand? Just trying to identify the object in your hand.
Key. Dime.
Yes. And keep your eyes closed. I'm going to write a number in your palm if you can identify the number.
3. 5.
Good job. You can open your eyes. So we've done your skin, musculoskeletal, abdomen, thorax, reflexes. I think that's all I can think of at the right now. So I'll just do the scan of the room as you requested to make sure there's no aids anywhere. Excuse the mess here. Thank you.